Hey everyone, welcome back to Graft Academy. Today we're answering one of the most common questions people hear at the dentist. What if you don't have enough bone for a dental implant? If your dentist told you that your bone is too thin, too soft, or too shallow for an implant, it can sound discouraging. But here's the good news, in most cases, it can be fixed. Modern bone grafting techniques allow dentists to rebuild the bone that's been lost, giving you the foundation you need for successful implants. Let's start by explaining why bone loss happens in the first place. When you lose a tooth, the bone that used to hold it in place loses its purpose. Without the stimulation of chewing and biting, your body begins to resorb that bone, meaning it breaks it down and absorbs it back into your bloodstream. This process starts quickly after an extraction. Within just a few months, the ridge can lose as much as 40 to 60% of its original width and height. The longer you wait, the more bone you lose, and eventually, there may not be enough left to support an implant. Dentists measure this bone in 3 dimensions: height, width, and density. They use 3D cone beam scans to visualize your jaw in detail, looking for enough bone to fully surround and stabilize the implant. An implant needs solid bone on all sides to fuse properly. If part of it would stick out of the ridge or extend into an empty space, the implant wouldn't be stable. That's when grafting becomes necessary. So what happens if your scan shows that you don't have enough bone? That's where bone grafting comes in. There are several proven procedures that rebuild missing bone and prepare the site for an implant. Option 1. Socket preservation. If your tooth has just been removed, your dentist can place graft material directly into the socket. This prevents early bone loss and keeps the ridge full and ready for an implant later. It's the easiest and most predictable graft to perform. Option 2. Ridge augmentation. If bone loss has already occurred, a ridge augmentation can rebuild the width and height of the jaw. Your dentist places graft material along the thin or sunken area, often using a membrane to protect it as it heals. After 4 to 6 months, the graft becomes solid bone and can support an implant easily. Option 3. Sinus lift. For the upper back teeth, the bone under the sinuses is often too thin. A sinus lift gently raises the sinus membrane and places graft material underneath, adding several millimeters of height. This allows for strong, stable implants even in the upper jaw. Option 4. Block grafts or advanced reconstructions. In severe cases, a small block of bone may be taken from another part of your jaw or from a bone bank and secured in place. This technique restores both shape and volume and is often used for major reconstruction. The amazing part is that all of these procedures use your body's natural ability to regenerate bone. The graft material acts as a scaffold, and your cells gradually replace it with living tissue. Once healed, the new bone behaves just like your original bone. It can hold an implant securely for life. Some patients worry that not having enough bone means implants aren't possible for them. That's almost never true anymore. With today's materials and techniques, even patients with severe bone loss can be successfully treated. Your dentist's goal is to design a plan that fits your anatomy. That might mean one graft, a staged approach, or using growth factors like PRF to speed healing and improve results. Once the graft has matured, usually after 3 to 9 months depending on size and location, you're ready for your implant. To summarize, if you've been told you don't have enough bone for an implant, that's not the end of the story. It simply means your jaw needs a little rebuilding first. Through socket grafting, ridge augmentation, sinus lifts, or block grafts, dentists can restore lost bone and make implants possible for nearly everyone. With modern bone regeneration, lack of bone is no longer a permanent barrier. It's just the first step toward restoring your smile. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone who's been told they don't have enough bone for implants. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.